Rajita, and today I welcome you all to this session. And here we are going to discuss regarding the intra-operative care. So, in the previous session, already we have discussed regarding the peri-operative care, right? We have seen it is the medical or nursing care which will be provided in an integrated manner to those clients who are having a plan or who are having the chances to undergo a surgery. So this is a period of time which is basically indicate the time period around the surgery. So we have seen the perioperative care is divided into three phases. This includes the phase as pre-operative care, that is just before the surgery the care will be provided to the client. The next phase or the second phase of perioperative care is intraoperative phase. We have seen this is a time phase basically suggesting the care which will be provided to the client when the client has shifted to the operation theater or during the time of surgery the care will be provided to the client, and this phase is known as intraoperative phase. The next step we have seen in perioperative care is the post-operative phase. Here in this session, we are going to discuss first regarding the intraoperative phase and the nursing responsibility during this phase. Now we are going to read regarding the meaning of intraoperative care. So it is a nursing or medical care which will be provided to the client during the time of surgery. Now, intraoperative phase or intraoperative care starts from once the patient is shifted from a clinical unit to the operation theater for the surgery, and it ends with once the surgery is already done for the client and the client is shifted to a post anesthesia care unit or maybe a surgical intensive care unit. So I hope you are completely aware now regarding the intraoperative phase. So remember, in this phase the medical and nursing care would be provided to those clients who are undergoing a surgery, or during the surgery we are going to take care of the patient. That is what is called as the intraoperative care. Now, nursing care during this intraoperative phase needs an understanding of the basic of the surgery and also the surgical interventions. This phase also allows the nurse to monitor the patient reaction towards the any stressors related to the surgical environment or the procedure of the surgery. Now, although all surgical procedures actually poses the same risk or potential complication for the client, but the need of intraoperative care basically depends on the current health status of the particular individual client who is undergoing the surgery, and also it depends on the types of surgery. It basically means the type of intraoperative care would definitely vary from if it is a major surgery compared to the if the surgical procedure is a day care surgical procedure. So depending on the type of surgery and also what is the client's health status, depending on that we are going to see the intraoperative care will differ from person to person. But you need to remember the basic of the intraoperative care would be same for all of the individual who are undergoing a surgical procedure. So in this phase of intraoperative stage, the nurse pauses the main role to provide a effective care. So they can promote the healing of the client after the surgery as well as they can prevent any occurrence of complication or any incident during the time of surgery or post of the surgery. So now here we are going to read regarding the departmental layout of a surgical unit. Now why you need to know this is in order to provide a effective intraoperative care. A nurse or a medical professional should know how the surgical unit works during the time of surgery. Only then you can provide a very comfortable and effective care to the patient to promote their healing and manage the client for the prevention of any complication to occur during the time of surgery. So surgical suite is actually a controlled environment which is basically designed to minimize the spread of pathogens, occurrence of any infection, as well as any cross contamination. So, and also the surgical departmental layout always promote a smooth flow of patient, the staff related to the surgery or the surgical team, as well as sterile equipments which is needed to provide a safe patient care. So you have to remember surgery is a very critical phase for each and every patient. Now, departmental layout should be comfortable enough to provide effective patient care. It also will be having a specific technique so that the patient, the surgical team member, as well as the sterile equipment can be flow in a sterile way or can be flowed in a very smooth way in order to perform the surgery in an effective manner. So here we are going to see the surgical unit basically will be divided into some distinct area. Now this distinct area are classified under three sections. The first area is unrestricted area, or which is also called as a non-sterile area. The next one is a semi-restricted area, and the third area is a complete restricted area. So I hope you are clear now that the surgical unit will be divided under three distinctive area. It includes a unrestricted area, a semi-restricted area, and a complete restricted area. Now we are going to read about what do you mean by this three different areas. First, we should learn about the unrestricted area. So you have to remember it is a place which is nearby to the operation theater but where no much surgical asepsis or surgical sterility is maintained. So here people even can enter with their street clothes. So to enter into our unrestricted area, a person do not need to wear surgical gown or do not need to follow any surgical asepsis technique. So for example, of unrestricted area are the entry point or the staff locker room or the changing room related to the operation theater, even the nurses station outside of the operation theater. So these are the areas which are considered to be the unrestricted area. So these are the points where the surgical team members will be meeting to the caregivers of the patient who are undergoing a surgery. Now next, we are going to learn about the semi-restricted area. This basically includes the surrounding area of the actual operation theater, mainly the corridors. So you have to remember in semi-restricted area, only authorized staff member can enter. And also while entering to this unrestricted area, a particular individual should wear their appropriate surgical gown or they have to be in a surgical attire. Even they should cover their head and facial hair completely. So I hope you're understanding the essentiality of the distinction of the area inside a surgical unit is mainly to assure a infection free zone, as surgical technique poses high risk of chances of spreading infections and pathogens. So now we have learned regarding the semi-restricted area. It basically includes all the corridors which lie beside the actual surgical unit or surgical room. Now we are going to read regarding the a complete restrictive area. So restricted area or a complete restricted area in a surgical unit basically suggest to the surgical room where the surgery would be performed. Now here we will be seeing that the high quality asepsis will be maintained. It will be having a non-sterile and sterile zone as well. We are going to see the non-sterile zones are the surrounding area, and the sterile zone will be considered completely near area of the surgical table, or where the surgeons and the scrub nurse or the surgical team will be present and doing or performing the surgery for the client. That is considered as the sterile area. And beside that, where the circulatory nurse will be present, those areas will be considered as a non-sterile area inside this restricted area or inside the operation theater. So, as I have mentioned, this physical layout is designed to reduce the cross contamination or spreading of infection, as well as it helps to maintain a normal flow of clean and sterile supply, as well as good and easy access of the surgical team and the patient and their caregiver. So we're also going to see for some operation theater will be having attachment with a holding area. Now, what is it the holding area means? So basically, it is known as a pre-operative holding area. So generally, we call this holding area as a special waiting area for the client or for the client's caregiver. Now, just before the surgical unit entrance, the client will be kept into the holding area where we are going to see basically a intra-operative nurse will be doing the adequate assessment before starting of the surgery or before starting the procedure of the surgery. Now we are going to discuss regarding the operating room. So you have to remember this is a restricted zone and which is geographically, environmentally and bacteriologically controlled area. So it is preferable that the operating room will be lying or will be located next to a post anesthesia care unit or maybe a surgical intensive care unit. Now, this allows a quick transport of the patient from a operation theater towards the clinical unit where the observation of the patient will be done after the surgical procedure is over. So as I have mentioned, this operating room also will be containing of sterile and non-sterile zone. So in sterile zone, only some authorized staff member or member of surgical team can enter, and they will be completely or they will be directly related to performing of the surgical procedure for the client. Now this sterile zone basically consists the surrounding area of the surgical table. Now the non-sterile zone, there mainly some or few authorized surgical team member will be present who will not be directly related to the surgical team member who are performing the surgical procedure, but they will be doing the assistance to those surgical team member who are performing the surgery by providing them adequate or necessary instruments. Even those people who will be in non-sterile zone will be getting the responsibility to communicate with the surgical team as well as the patient caregiver in some specialized surgical procedure. Now we are going to read about the surgical team. So surgical team it is, as we have studied, that surgery is a technique or procedure which integrate multidisciplinary members, right? So here we are going to see presence of surgeon. Now for some procedure there can be presence of multiple surgeon, even there can be presence of surgical assistant. Anesthesiologist will be present who will be basically dealing with the administration of anesthesia prior to surgery, as well as the recovery from the anesthesia. Now, next one is the surgical team nurse or surgical nurse. Now, basically, we will be dividing the nurse who will be staying or inside the operation theater into two groups. It includes a circulatory nurse and a scrub nurse. So also the surgical team member will be consisting of nurses. Now the nurses can be classified here into two categories. The first one group of nurses will be called as the circulatory nurse, and the second group of nurses who will be present in the surgical unit are called as scrub nurse. So as we have studied that the circulatory nurse will be present in the non-sterile zone inside the surgical unit. They will be definitely maintaining the surgical asepsis, but they will not be directly performing the surgeries. Whereas the scrub nurse will be completely responsible to perform the surgery or to assist the surgeon for performing the surgery. And basically, they will be doing a complete or they will be following a completely surgical asepsis technique. Even they will be doing surgical scrubbing, and they will be responsible to take care of the patient during the surgical procedure. So, scrub nurse or circulatory nurse, they definitely will be a registered nurse for intraoperative care. So basically, these nurses will be providing or implementing the care during the surgical procedure. So basically, nurses will be preparing the operation theater before the client arrives. Even they will be having the responsibility of advocacy from the patient side. They will be maintaining the patient privacy, their dignity, and confidentiality during the whole perioperative period. Providing physical care to the client also is a responsibility of our intraoperative nurse. They will be also responsible to communicate with the all surgical team members as well as patient and their caregiver before the surgical procedure, after the surgical procedure, even if there is any need during the surgical procedure. Also, in some special scenario, the nurses will be communicating with the patient caregiver. They also have a major role to assess the patient need during the whole procedure of surgery. They will be monitoring the draping procedure before starting the surgical technique, and also they will be participating in the surgical time out. Nurses have also a very important role to document the whole procedure of operation theater. So basically, they will be documenting each and every details when the surgical procedure has been started or initiated for the client, when the incision has been made, what type of surgical technique has been followed, whether the asepsis has been maintained in a surgical unit or not, whether there is any abnormal incident has been occurred during the time of surgical procedure. That also has to be noted in a nursing diary or in a nursing document. Now they will be also focusing on the patient response towards the surgical procedure or towards the stresses. They will be also assessing the vital signs and hemodynamic stability continuously during the time of procedure as well as after the surgical procedure is done. They will also have a major role to compare the vital signs or any other findings or health findings with the pre-operative and a post-operative time. So now we are going to see here regarding the actual role of a circulatory nurse or a circulating nurse. So as we have learned that there will be two group of nurses inside a operation theater. One is circulatory nurse and the second one is scrub nurse. So let us discuss now first regarding the responsibility of circulatory nurse. So circulatory nurse, also known as circulator or coordinator overseas, and they are basically involved in the client's nursing care inside the operation theater during the surgical procedure. So first we are going to see the nurses will be performing some non-sterile activity here. So you have to remember the scrub nurse will not be performing any non-sterile activity, whereas the circulatory nurse will be responsible to perform all the non-sterile activity. As we have mentioned that the circulatory nurse will not be in a sterile zone or will not be directly assisting the surgeon to perform the surgery. Now, non-sterile activity involves the supply of any needed or any necessary equipment during the surgical technique. Even they will be having the responsibility to communicate with the surgical team as well as the patient caregiver and all other necessary non-sterile activities. Now, we are also going to see before the surgery is being initiated, the circulatory nurse will be having the responsibility to review the anatomy, physiology, the surgical procedure, the need of it, and also the surgical site. Next, we are going to see they will be assisting for the client's preparation once they have reached into the operation theater. Before surgical technique, as we have learned from the clinical unit, the nurses will be coming with the client into the surgical room or operation theater. Circulatory nurse have the responsibility to take the handover from a pre-operative nurse and assess the client in a physical way and also collect the history in details during this time to avoid any miscommunication related incidents. Next, we are going to see the circulatory nurse during the surgical procedure also ensure adequate and smooth supply of instruments. So they will be also continuously doing a pre-procedure verification and also procedure verification during the surgical procedure is performed. They have a major role to check the mechanical and environmental factor which may or may not associated with the surgical procedures. Next, we are going to see also the circulatory nurse will be assisting in the induction of anesthesia and they will be also helping or assisting to the anesthesiologist if there is any need. They have a major role even to look for or to monitor the draping procedure and all the sterile technique that is taking place inside the operation theater. Documentation is a very vital and major role of circulatory nurse. So basically, during the whole procedure, circulatory nurse are the one who will be maintaining the documentation. Even they will be monitoring the blood, even the fluid loss and any urinary output from the patient who are undergoing the surgical technique. Circulatory nurse also will be preparing, recording, will be labeling and sending any pathological or any anatomical samples to the exact location for further diagnostic procedure after or during the surgery. Circulatory nurse will be verifying, dispensing, even they will be recording the medications which has been used during the time of surgery, including the local anesthesias. They are the major coordinators who will be coordinating with all the surgical team member during an intraoperative phase, and also they will be accompanying the client once the surgery is done to a post anesthesia care unit or maybe a surgical intensive care unit. Circulatory nurse have the major role to provide a handover or handoff report to the nurse who are present in the post anesthesia care unit or maybe a surgical intensive care unit. So circulatory nurse will be providing all the necessary information, all the incident that has been taken place during the time of surgery, even the client's response, their vital signs and hemodynamic stability to the nurse who were present in the post anesthesia care unit or surgical intensive care unit. So I hope you are completely aware now about the role and responsibilities of the circulatory nurses. So basically, they will be managing the areas where the surgical procedure will be performed. They will be also responsible to document, to communicate, and to maintain a flow of equipment or necessary things during the surgical procedures. Now we are going to discuss regarding the role and responsibilities of scrub nurse. So we are going to see the scrub nurse will be actually complete their surgical hand and arm scrub before initiating of the surgery. They will be also wearing the gown and gloves, and they will be maintaining the surgical asepsis inside the operation theater. Scrum nurse also have the responsibility to make sure that all other surgical team members are maintaining and performing the hand and arm scrub, and they're maintaining a proper aseptic technique inside the operation theater. They're also responsible to prepare the instrument table, or we can say they are responsible person to arrange all the necessary sterile equipment near to the operation table in order to allow a smooth flow of the instruments for functional use during the time of surgical procedure. They will be also assisting the surgeon in the draping procedure. They will be also doing the scrubbing and cleansing for the client prior to the surgery or prior to the incision. Scrub nurse also will be participating in the surgical time out procedure. Now they are the responsible person who will be passes or who will be passing the instruments to the surgeon during the time of surgery by anticipating their need. So basically, the scrub nurses will be passing the instruments or sterile equipments during the surgery to the surgeon by anticipating their need in the surgery. Scrub nurse also will be maintaining accurate number or accurate count of the sponge, gauze pieces, needles, and all other instruments or medical devices which are being used during time of surgery. So it is a role of a scrub nurse to count or to maintain the count of all the devices, even the sponges and gauzes which has been used during the time of surgery. The essentiality to maintain the count is because this devices can actually retain inside the patient body. So in order to prevent the incident, the nurses will be responsible to make a count before the surgery, even after the surgical technique is completed. So, as I have mentioned, the scrub nurses are the responsible one inside the operation theater who will be monitoring the practices of the aseptic technique for others, even for itself. They will also keep a track of the irrigation that has been or the irrigation solution that has been used during this time of surgery to calculate the fluid volume loss. Scrub nurse also will be accepts, verifies, and also reports the used medication during the time of surgical procedure by an anesthesiologist or by the surgeons. So I hope till here you are completely aware regarding the role and responsibility of the circulatory nurse and the scrub nurse. Now remember, this scrub nurse and circulatory nurse will be having the responsibility during the time of surgery. So here we are going to see the common responsibilities or role and responsibilities of the nurses before the surgical technique or before the surgical procedure is initiated. So we are going to see initially, as we have mentioned, basically the circulatory nurse will be performing a history collection and a thorough physical examination just before shifting the client to the operation theater. They will also assess the need of the surgery, the surgical site, the disease condition that has been reported, or the client, which diagnosis has been indicated there. Also, they will be looking for the indication, the contraindications of the client prior to the initiating of the surgery. They will also monitor and assess the hemodynamic stabilities as well as the vital signs of the client. Psychosocial assessment also would be done by a circulatory nurse prior to the surgical technique. They will be reviewing the chart or health chart of the client who is a recipient of the surgery. So basically, they will be reviewing the past and present medical history, past and present surgical history, the indications and the need of the surgeries, the surgical site, the essentiality of the surgery, the technique of the surgery that has been planned for the client's cardiopulmonary and respiratory status, potential risk for infection or development of any other complication. Now, after doing all the assessment, then only our nurses would be informing the other surgical team that the client is in a stable state to receive the surgical procedure or to start with the surgical procedure. So even the circulatory nurse will be having the responsibility taking the handover from a nurse or from a nurse who is present in a clinical unit and shifting the client from a clinical unit to the operation theater. Now, as we have seen, now we will be seeing the responsibility during the surgical procedure. So basically, the scrub nurse has the major responsibility during the surgical procedure. Even the circulatory nurse will be playing a very vital role to manage the flow of all the instruments during the procedure. So the nurses would be having responsibility towards the room preparation before surgery, even after the surgery. They will be even having the responsibility of transferring the patient from a clinical unit towards a operation theater. Scrubbing and cleansing would be done for the client. Even the nurses are responsible to perform scrubbing, gowning, gloving for their own self. Even they will be maintaining and making sure that all the surgical team members are following the surgical aseptic technique inside the operation theater. So nurses will be performing the basic surgical aseptic technique inside the operation theater. Even the nurses inside the operation theater will be assisting the anesthesia care provider. So nurses plays a vital role here as a patient advocate. So they will be assessing the patient safety and they will be make sure that the environment and the medical procedure are safe for the client. Positioning the patient also would be generally done by a scrub nurse. So nurses would be also responsible to maintain the normal temperature inside the operation theater, as well as prevention of hypothermia would be done for the client. Preparation of the surgical site would be done by a nurse. So generally, we are going to see the scrub nurse will be performing a mechanical scrub and cleansing prior to the incision in order to prevent the chances of the development of infection. Scrub nurse will be also assisting the surgeons by providing or by handling over all the necessary instruments during the surgery by monitoring or by anticipating their need. Documentation is very important role of a nurse. Basically, the documentation will be maintained by the nurse or by the circulatory nurse here. So they will be documenting each and every incident during the time of surgery or during the intraoperative phase. From shifting the patient to the operation theater till the patient is shifted to the intensive care unit or a post anesthesia care unit, we are going to see the nurses will be documenting each and every incident during this time. They will be documenting regarding the vital signs, hemodynamic stability of the client, the response of the client towards the surgical procedure and the stressors. Also, we will be seeing they will be documenting the whole surgical procedures and any incidents that has been occurred during intraoperative phase. We are also going to see the nurses are responsible to a note or to document regarding the medications that has been used, even the anesthesia that has been used during the time of surgery. Transferring the client is also a very important role of the nurse. So soon after surgery, we are going to see the circulatory nurse will be transferring the client from the operation theater towards a post anesthesia care unit, or maybe a intensive care unit or surgical intensive care unit. Here, the circulatory nurse are responsible to hand over all the necessary information to the nurse who are present in post anesthesia care unit or intensive care unit. They will be communicating regarding each and every important data related to the client, and they will be also informing regarding the whole incident during the time of surgery and the patient hemodynamic stability, expected outcome, their vital signs, and their response towards the surgical procedure and during the intraoperative phase. So that's how the scrub nurse and circulatory nurse will be maintaining or will be taking the major responsibility to make sure that the client is safe during the whole procedure of surgery. Now, as we have learned here, related or regarding the information of intraoperative care and the nurse's role, next we should definitely learn regarding the post-operative phase and the nurse's role and responsibility during that phase. So stay tuned for the next session. Thank you so much for attending the session. We'll meet you guys in the next one.